السلام عليكم ورحمة الله وبركاته. أسعد الله مساءكم بكل خير. Hello everyone and a great afternoon to you all and welcome to NTI's series of webinar. Today's webinar is on saving lives with CPR and AED. My name is Firas, live from Muscat, the capital of our beautiful Oman, and I'm the moderator for today's session. I'd like to introduce today's speaker, Dr. Mohammed Fazalullah, and our Zoom master, Latifa. For your information, a recorded version of this webinar will be available on our YouTube channel, which you can watch again later if you missed anything. We'd love to hear from you. So if you have any questions, there will be a question and answer session at the end of this webinar. Also, you can always send us your questions to info@ntioman.com. Don't forget to follow us on Facebook, Twitter, Instagram, and LinkedIn. And please give us your feedback either by commenting here or, like I said, sending us an email to info@ntioman.com. Those who stay till the end of the webinar and complete the poll will receive a certificate of attendance. If you haven't filled the registration, then please send me your name and email address to info@ntioman.com. Now, before I pass this mic to Dr. Fadel, I just want to remind you that it was easy and simple to register, and I'm sure you're going to enjoy this webinar with Dr. Fadel. But when it really comes to an emergency like this, not everybody is strong enough to do what Dr. Fadel can't. Don't worry, that's okay. We are all humans. But please make sure you call for help. So for those who have just joined us, welcome to NTI series of webinars. And now over to you, Dr. Fadel.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you, Firas, for a nice introduction about our organization and about me. And like you said, it's very important for us to be response ready. And for that, we need to attend the course, of course. But right now, in this webinar, I will try my best to bring in awareness about how to save lives while you're at home or you're at your workplace or while you're traveling. Okay, so we're going to go through three parts of this session. First part is the first aid, and then CPR, and then AED. We'll understand each of them very clearly. What is it and how is to be done and everything. CPR is cardiopulmonary resuscitation, and AED is automated external defibrillator. It's not important to remember the full form. We all forget. But what is very important to know is how to do this and when to do this. That is very critical. You know, many times what happens is we see people unconscious in front of us or they're unresponsive and we don't respond. We heard about CPR, we heard about the machine, we don't do anything. So let's go through this now. And before we start, I'm sure all of you know what's the meaning of first aid. First aid is the immediate but temporary assistance or treatment provided to a person injured or suddenly becoming ill before taken to a hospital or an ambulance arrives at the site. It's a very big definition. Forget about that. What you should do at that time when you see a person unconscious, that is very important. I mean, it could be anybody. It could be your parents, could be your brothers and sisters, or colleagues, or a traveler who's with you. So what we do is called first aid. So there are the principles of first aid that you preserve life, you avoid further damage to the casualty, and you promote recovery. You can use casualty or victim, both the same. Okay, and of course, before you touch somebody, it's very important to wear gloves and check your gloves in your first aid box. There are many types of gloves. There are some material in the gloves which can itself cause allergy. So make sure you use the right gloves and you're wearing gloves to protect yourself from the diseases. There are some diseases which spread, from person to person, the blood to blood, and that's why you wear gloves. Of course, if you come to our center, we will give you demonstration and then gloves for practice and practice as much as possible. So when you see a person, your immediate response should be remain calm. See all the training, all the awareness program, whatever you see on YouTube, whatever you see on social media, will all collapse. You'll forget everything if you do not remain calm. And then you assess situation, and then you analyze and all those things, all the steps. Of course, all these things, when you visit the observer center, you will be able to actually show us the readiness of your efforts. You just skip this and then go ahead next part, which is there are some life-threatening conditions, and of course there are many, but we are just dealing with 3 or 4 of them, which is asphyxia, heart attack, bleeding, shock, and unconscious. Now, sudden illness is you see a person or you know the person since many years, like your relatives, your spouses, your brother, sister, whatever, whoever around you. Suddenly, they are having some problem, and you are like, "What's happening?" So, these are the topics that you should remember. It may be stroke, it may be epilepsy, it may be diabetes, it may be fainting, heart attacks, asthma, and there are many actually. So there is a mnemonic for to remember how you address a person. If you see him, if he's talking to you, remember sample. Sample, SAMPLE, S stands for signs and symptoms, which means that when you see a person, and he's talking to you, and you want to know more about the person, and you want to know, I mean, what happened to him. So you use this sample method. So you ask, what are the signs and symptoms? Are you having stomach pain, chest pain, headache, whatever? They say, no, nothing. I don't have anything. So, and then so you use the next letter, which is A. Ask them if they have any allergies to anything. For example, food allergy, medicine allergy, whatever. M is medication. What medicines are they taking, or what medicines they have forgotten to take? Either ways, it will be a clue for you to find what is a problem. And P is previous problems. Some people, they have diabetes, hypertension, stroke, seizures, all these things. So you can just ask them, do you have any previous problems? So you get asked any of them, SAMP. If it doesn't, then you go to the next one, which is L. L is, what did you last eat or drink? And then the last one is E, which is events. Well, let me just share you with a small story about how we have used this sample method in our hospital. 15 years back, there was a patient. She admitted her husband in the hospital, and then we were trying to do all the investigations. We could not pinpoint what the problem was. Then we asked the wife again, what exactly happened? She said that my husband coughed blood. So the history changed. Before, she didn't say this. So coughing blood, the focus is on lungs. Vomiting blood, the focus is on the stomach, right? So see how it's so important, and how important role you will play when you will see any person having it. Now let's come back to the real action, what you should do when you see a person problematic. So in an emergency, you check for safety, you check for safety for victim, okay, all these steps. Let me show you a small video, and we'll come back to the slides later on.
So when you see a person unconscious, you have to make sure that the area is safe. Look right, look left, look in front, look back, look up. Everybody is safe. You are safe, victim is safe, area is safe. And then you need to go and walk near to the victim and check for response. Are you okay? Are you okay? So he's not responding. When somebody is not responding, the next step is help. You need to delegate the work to somebody. If there are people around, you call 9999, you get the first aid kit and you get the AED. AED is automated external defibrillator. And when they have gone, meanwhile, you have to check for breathing. You scan the chest, scan the abdomen and the face, go up and down. So he's not breathing. When somebody is not breathing, the next step is chest compressions. You place your hand in the center of the chest and get ready for chest compressions.
When you check for response, of course, the person will not respond, but there are levels of responding. For example, the person can respond quickly, like fully conscious, or he or she may be drowsy, or maybe stupor, or maybe coma. So there are levels of, medical words, but it's okay. If the person is not responding, like I said, told you, you have to check breathing, and you have to decide whether you should do chest compressions or not. And like I showed in the video, you have to use the heel of the hand in the center of the chest and then start chest compressions. Okay. Because of COVID, we are not doing mouth-to-mouth breathing. And even without the COVID also, for some reasons, you're not able to give breaths. For example, somebody is having a fracture in the mouth, or somebody is bleeding, or for some reasons you do not want to give mouth-to-mouth breathing. Forget about COVID. Even otherwise, if you do not want to give breaths, it's okay. You can just do chest compressions. Keep on doing chest compressions, and make sure that you do a high quality chest compressions. Previously, 15 years, 20 years back, it was all only compressions and compressions. But now it's called as high quality compressions. The compressions should be of proper depth, should be a proper rhythm, and it should be nicely timed. You don't do fastest compression, then stop and then fast and stop. No. You do rhythmic, that's called as 30 compressions in 15 seconds, they said, or 16 seconds or 18 seconds. So these are some causes of unconsciousness, why people become unconscious. It could be any one of them. Okay, you need not worry about why he become unconscious. Is it because of shock? Is it because of bleeding? Is it poisoning? Diabetes? No, you need not worry about that. Your worry is whether he's breathing or not, and you start chest compressions immediately. If the person is breathing but unconscious, do you do CPR? No, don't do CPR at all, because the person is breathing. So you check the whole body for any injuries, anything like medical information, jewelry, the pocket, whatever. If nothing is there, then you can turn to the sideways. This is called a recovery position. And of course, we will do this practicals if you visit us. These are all the practical skills that we learn in a course that you come 20. So this is a figure about how to remove object from your throat. It's for adult. We will learn also about child and infant, of course, in the classroom based. Okay, now this is the most important part, which is CPR, which is cardiopulmonary resuscitation. Okay. If some of you have done this, do know about first aid, you'll be hearing about ABC, right? Now it's changed. It's CAB now. First thing is compressions. Compression should not be delayed. So this is the, you can see this hand and see this, this entire arm is straight. This joint is not moving. This joint is not moving. This joint is not moving. Only this joint is moving. The hip joint is moving. If you use this method, you can do it for a longer period. And if you do it some other way, if you bend your wrist, or you bend here, or you bend your shoulder, you cannot do chest compression for a longer period. Okay, so let me show you a small video about this.
So when you're doing chest compressions, you are not just doing chest compressions, you're doing high quality chest compressions. By that, I mean the position of your hand, the depth of your compression, the rhythm of your compressions, and the rate. It should not be faster, it should not be slower. So your hands should be in the center of the chest between the nipples, and use your heel and keep your right hand or left hand and the other hand on top. Elbows straight, don't move your wrist joint, don't move your elbow joint, don't move your shoulder. You only move your from a hip. Then you can do it for a longer time. I'm going to do 30 chest compressions, and this will also give us the feedback about whether the compressions were high quality or not. You will see two green lights here. One light is for depth, the other green light is for the rhythm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So this is a sign for a high quality chest compressions. Two green lights, and of course in the real life you will not see such lights. It's only because we have a controlled training environment. That's why we have these two lights. So when you come here for training, if at all, you can get hands-on practice on our mannequins.
I want to ask one question to you. What is the first step when you approach a person, an unresponsive person? If you can ask that. Okay. Now, AED is a machine. I'll show you a video how to use a machine. And so, the long steps given here about how to use AED, place AED by the victim's shoulder, all the steps are there. I'll show you how to use it later on.
Dr. Fadal, I think I have 10 participants who answered. One said take a video on mobile, and the rest said check for safety, call for help, and get an AED. What do you say?
Yeah, the answer, you mean to say the answer is check for safety, call and get help. Yeah, get AED. Yeah. See, this is a response to anything. We don't take a video on mobile. We have to get away from this social media thing and help people and not just take a video. So the slides in front of you are all about AED. So all these are all from the cardiac science company. The instructions are there. I've just put the same words, how to maintain AED. It's not important for you. Let us learn how to use the AED.
So you have delegated somebody to get you the AED. So AED has arrived. When the AED comes, you need to switch it on immediately. So switch it on like this and wait for the machine to speak.
Tear open package and remove pads.
Remove pads.
Tear open package and remove pads. Tear open package and remove pads. Peel one pad from plastic liner.
Remove one pad from the plastic liner.
Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest.
Place one pad on bare
Place
upper
one pad
chest.
on bare upper chest.
This is done.
Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
Remove second pad and
Peel
place
second
on
pad
lower
and place on bare lower chest as shown.
chest.
Do not touch patient.
The machine says do not
Analyzing
touch.
rhythm.
Patient analyzing rhythm.
Do not touch.
So do not
patient.
touch.
Analyzing rhythm. Shock advised. Charging.
The machine says
Stand
analyzing
clear.
rhythm.
Push flashing button.
Push
to
flashing
deliver
button.
shock.
So you need to press the shock button.
Stand clear.
Stand clear.
Flashing button. Shock delivered. It is now safe to touch the patient. Start CPR.
Start CPR.
Give 30 compressions. Then give 2 breaths.
So you continue this for 2 minutes, and then the machine will reanalyze after 2 minutes. And then again the machine will decide whether to give shock or whether to do CPR. So 2 minutes, machine assess. 2 minutes, machine assess.
I'm going to ask you one more question right now. When getting help, you have to be loud, clear, and assertive, or you panic and you run away from the scene. Now, like I showed in the video, AED is, yeah, that's good. That's good. Excellent. Yeah, everybody has done a good job. Good answer. You have to be loud, clear, and assertive. By assertive, I mean you do not request somebody to. Yeah, that's good. That's good. See, when you're getting help, oh, that's good answers. Wow, all of them are answering. Good, good. So you have to be loud, clear, and assertive. Yeah, okay. So what does it mean? What is the meaning of assertive? When you tell somebody to call, get first aid kit, get AED, you don't request them. You're not angry also. Get me the AED. No, you're not going to please get me the AED. You're assertive. Get AED, call 9999. So, don't be harsh, don't be. So let's do one more question. Why do we wear gloves? Yeah, I want all of you to answer, okay? The poll. And the very easy question is, why do we wear gloves? We wear gloves to protect from diseases or to start painting. I mean, of course, we are not discussing about general gloves. We're discussing about gloves to in a first aid situation. CPR stands for cardiopulmonary resuscitation, or it stands for camera, people, and record. It's not a time. You can take your time to answer the question. Yeah, please answer all. I want all of you to answer the question. I don't know how it is camera, people, and record. CPR is cardiopulmonary resuscitation, or is it camera, people, and record? Okay, I think 18. The last question. AED is a machine that saves lives, or is it a currency? Of course, we're dealing with first aid here. That's good. 7, 9, out of 10, 11. Of course, it's a currency, which is dirhams, but we're not dealing with this webinar. Has nothing to do with dirhams. It is to do with saving lives. Okay, I think all are done. Okay, there are some other topics which are also very important in first aid, which includes bleeding. Of course, as we know that blood circulates the body through arteries, veins, and capillaries. Arteries, thick pipes, blood flows through it really fast. So if arteries are cut, more blood will ooze out, bleeding will be more. Veins are not so thick, and the blood moving in that blood, the blood moving in the veins are not so having a lot of pressure. So if you remember in the hospital, they will insert the needle in the veins, not in arteries. So how do you recognize if the bleeding is from arteries, veins, or capillaries? It's very simple. If you see the blood which is bright red and it spurts like a fountain, like something fast, then it's artery and it's dangerous. And if it's from the veins, it is not the bright blood. It's like a dark blood, and the blood oozing on it less. It's good for you when you give a first aid to somebody. If you want to differentiate between a dangerous bleeding or a normal bleeding, I mean, not much, that's not normal, sorry. And we say if the bleeding is not so dangerous, then you can see the color and the amount of blood coming out. Yeah, the same thing, the signs and symptoms. How to differentiate between arterial bleeding and venous bleeding. Yeah, so there's also a practical skill where when you see a blood, what do? What's the first aid? You apply pressure, and of course you have to wear the gloves before you touch the blood. There are so many diseases that spread by blood-to-blood contact, which is AIDS and hepatitis B. So you have to be very careful. We do have treatment for these two diseases, but we cannot completely eradicate. So you have to be careful. And after you put the bandage, you should make sure that the bleeding is stopped. If it doesn't stop, then you need to put a tourniquet. And of course, all these words are all, if you're able to understand only when you visit a classroom session. These are all practical skills. So yeah, this is internal bleeding. How do you know that inside the body something is happening? So, I mean, bleeding is happening inside our body, maybe inside our head, inside our chest, inside our stomach. It's quite easy actually. If the bleeding is going in the brain, inside the brain, the person may vomit or the person may have seizures. If it is in the chest, the person may cough blood, or if in the stomach, the person may vomit. And of course, you can see under the skin, there's some blood. But it's not about under the skin, it's about something inside the body. The blood can come out of the body from the different holes, for example, the nose, ears, what do you call it, urine, and through stools. If it's bright red, then the blood has come out from the exit area. But if it's a dark blood, that means the blood is being bleeding somewhere in the stomach or intestine. Okay, so these are some pressure points that we have in our body. So the bleeding usually goes on in the, for example, if it's on the arms, right or left, there is a point here. See, this is the point here. You press it, the bleeding will be from this side. This is my person. Yeah, here. So if you press here, the bleeding from this side will be less. And if you press it here, the bleeding from the legs will be less. It will reduce the bleeding. Here, it could be fractured bones, skull fractures, trauma. So what do you do? What is the first aid for internal bleeding? Lay casualty down, make comfortable and provide reassurance. Check further injuries, monitor breathing, and transport. What do you do for the bleeding from the ears? Of course, the reason is maybe head injury, skull fracture, blast. You do not stop the bleeding and position the casualty so the blood can flow out freely. Cover the ear doesn't mean that you stop the bleeding here. You cover the ear with a clean pad, securing lightly with a bandage of a distractor. Okay, for the nosebleed, you sit with the head forward. Okay, see, hold like this. All of you can do this right now. You can pinch your nose. There are two parts of the nose, right? The hard part and the soft part. You have to pinch the soft part. Can all of you do it? Okay, so you pinch the nose like this, and then you head forward. In the hospital, you must have seen patients sitting like this, the head backwards. That is a treatment. This is the first aid. So there's a difference between first aid and of course you tell the person to breathe by the mouth, and any blood is there in the mouth. Okay, this is a big topic, right? Heart attack. And how do you make sure that the person is having a heart attack or not? There are many signs of heart attack. We know the chest pain moving to the hand, going back. I remember one of my patients, he had a jaw pain and he came to me as an OPD patient, and he had a jaw pain and nothing else. Huh? There is no sweating, there's no chest pain, there is no nausea, there's no vomiting, there's no hand, nothing. He just had a jaw pain. So I told him, you just need to go to the dentist surgeon who's sitting next to me. And then he went to my colleague, and the colleague he saw all the X-rays, all investigations done. He said nothing is there in the jaw, nothing is there in the tooth. He came back. So I said, how is it possible that nothing is happening? I mean, we don't know what's happening with you. So as a rule, the policy of hospital policy, we have to at least take the blood of the patient and do the ECG. And he did that, and through ECG, we came to know that he was having heart attack. So you see, heart attack signs and symptoms are, of course, they're very fixed, but it's not like all the signs and symptoms has to be the person, like chest pain, sweating. Oh no. One is enough. Ladies, all the women, they get heart attack. And the most common, I mean, I cannot say most common, but one of the most commonest symptoms for the ladies is they stomach pain. Can you believe that? They get stomach pain, and that's a sign of heart attack. So what do? Because you call for help, make person comfortable with reassurance, keep assessing the person, check breathing, and of course there is this aspirin to be given, but you need to check with your local doctor or your family doctor or your cardiologist. They'll advise you whether you should take aspirin or not. Stroke is another problem. This happens in the head, right? There's a bleeding. It could be a blocked or it could be a burst. There are two things in the stroke. And how do you recognize what is happening? So remember fast. F is face. The person will not be able to, one side is not, like this. And A is arm. The hand or the fingers, you're not able to move. And S is speech. You tell him something or you ask a question, he may not be able to, or she may not be able to answer properly. And T is time. Time means you need to get to the doctor immediately. So remember fast with stroke. First aid, clothing. Oh yeah, diabetes is another big topic of first aid. See, we can Google about diabetes a lot here and there. but what you should practically do for a person if you want to take care of it. For example, you have a colleague, you know he's having a diabetes. So there are many ways in which a diabetic person can get into trouble. For example, they will not be able to control their emotions. Sometimes they will not be able to take medicine on time, or they have taken the medicines, but they have not eaten food. A lot of things are happening with the diabetic person. So you need to know whether their medicines are on time, whether they have any issues, check their blood sugars periodically. There is a site called diabetes.com. It's a site from another body, American Heart Association. Okay, this is a good one. Suppose you do not know whether whether the sugar is high or sugar is low. So what do? Do you give sugar or you don't give sugar? You give sugar. And I'm not saying this, it's in international guidelines. So another topic is shock. For first aid, what do you do for shock is lay the casualty down, lift the legs up, make comfortable, give a blanket, and do not give casualty anything to drink. Seizures, epilepsy, convulsions, fits, they're all same. So what do you do when the person having seizures? Okay, take casualty down, protect casualty from harm, all these things. Do not place any object between the teeth. Okay, for head injury, you have these first aid. Right, so let's switch to question and answers. So what we do is you ask questions by sending a message, and I'll see in the chat. If you have any questions, then I'll ask some questions. I told you about sample, right? SAMPLE. Can somebody tell me what S stands for? Or you can type. You're asking sample when you want to know what the problem is with the person. So S stands for, no, it's not safety, George. Good try. You're asking a person questions. What do you ask a person? That's a good question. Is it by law to have some people in offices having first aid training? Yes. Some of the companies have, it's a legal requirement for them to have a first aid. Yes, it is. Children choking. Yes, it's a big issue. It's the same thing as I told you the video. I was sorry, the slide. Wait, let me show you again. It's choking. You know, when person is choking, you have to hold here and then give a thrust. For children, the same thing. But for babies is different. You tap from behind. Okay, all these are practical skills. You will be able to learn it when you come here. Symptoms, yeah, good answer. S stands for signs and symptoms. Good one, Najwa and Salma. Okay, if the patient for whom I am going to do first aid has broken chest, what is the procedure? Oh, that's a big issue, my dear. You cannot do chest compressions. That's called as flail chest, with the ribs. Yeah, good one side symptoms. That's correct answer. Okay. Yeah, the procedure for Muhammad is the patient for whom I'm going to do first aid has a broken chest. What's the procedure? It requires special skills, advanced skills to deal with that. Of course, there's a procedure, and you need to assess first. Is it two sides of the bone broken, or is it just air oozing out, or is it blood and air oozing out? So, you need to find out that. Okay, what does A stands for? In sample, when you ask allergies, yeah, Mushraf, that's correct. So in sample, you want to ask a person the signs and symptoms. Then you ask the person if you have any allergies to anything. Yeah, good one. Dinesh, Salma, Mushraf, Shabu. Not Shabu, sorry. Shabu is not alert. It's allergies. Okay, what does M stands for? You're asking a person some questions. What does M stands for? Great answers. Wow. Najwa, George, Dinesh, medications. Salma, good one. Yeah, the next one is P. Thank you, Said, for taking us further. P is for past medical history. So in sample, S is science and A is allergies, M is medication, P is previous problems or previous medical history, past medical history. Okay. In medication, just remember that there are two things medications. Person is a diabetic. he hasn't taken the medicine, so he's having some symptoms. But a person who is on medication for some short period, for example, somebody took an antibiotic, okay, and then they get some problem, stomach problem or whatever. So you can ask them both the things, medication. Okay. So, doctor, what about tracheostomy when we do have to do it? Oh, Najwa, that is for special for doctors, and we cut it from here. I think you have seen some movies. You have seen Anaconda movie like that. Yeah, there was a procedure done. Yeah, you cut it here, and the person put a straw, and then person. Yeah. So Najwa, it's a specialist skill. You need to be in a medical industry, or a doctor, or nurse, or paramedic, also in military and some other non-medical area. They teach you how to do a tracheostomy. So in sample, SAMP is over. L, what does L stands for? Yeah, good, George. Yes. What did you eat last, or what did you drink last? Not just eaten, what did you last food or drink? Yes, that's good, Najwa. Good, Shabu. Yes, that is last food or drink. So you will get the answer in S, signs and symptoms, or you get the answer in A, allergies. You get the answer in M, one of them, or in P, or in L. If you don't get any one of them, what does E stands for? Events. Oh my goodness, Najwa should be given a special award. I think all her questions and all her answers are correct. Let me just check. Yeah. Miss Najwa. Yes. Good job, Najwa. Really appreciate. You were alert throughout the webinar. Thank you so much, ladies and gentlemen. It was a pleasure to be here. I hope you have learned something in this webinar. And of course, we are all available for you to give you hands-on practice on all the skills that we have gone through. Okay, you can email us on info@nti1.com, and all the best. Over to you, Fras.
Okay, thank you, Dr. Fadel, for answering those questions and for the great webinar. It was a pleasure having you with us. Don't forget to follow us and like us on Facebook, Twitter, Instagram, and LinkedIn. And please give us your feedback. We would love to hear from you, especially by sending us an email to info@ntioman.com. And for those who joined us late, you can always watch this recorded webinar on our YouTube channel. So this concludes our webinar for today. Thank you all for attending. We hope you have learned and enjoyed the webinar. Shukran. If you haven't filled the registration form, then please send me your name and email address again to info@ntioman.com. And I remember seeing 4 people, George, Muhammad, Uhud, and Mushraf, where they have only their first names. So if you want a certificate with your full name, so please make sure you send me those details to info as soon as possible. And now, if I may request you all to fill the poll that will pop up on your screen before leaving us. Thank you and have a great day.